All right, welcome back to the Dental Domination Podcast. My name is Dan Bryan. I'm the co-founder of Dentalscapes, but if you've listened to this show before, you know that is not what I'm here to talk about. I am here to have what I anticipate will be an awesome, probably mind-blowing conversation with Jessica Martin. She is the founder and CEO at Martin Management. They are a healthcare consulting company, and she's also, by the way, co-owner along with her husband of Martin Dental, a private dental practice in Eau Claire, Wisconsin. And so she definitely knows her stuff. I've been working with Jessica for quite some time now. She's actually been on the show in the past. So if you haven't already, go back and check out those previous episodes. But Jessica is, I think, the definition of change maker. She's action oriented and she gets the job done. And I'm also proud to say that I think within the last year or so, she's become a good friend of mine as well. So I'm really excited to be here today, Jessica. What can you tell folks about you, your background, and how you got into this ballgame?
Yeah, thanks, Dan. I do consider you a friend as well. So
Well,
I
I
love
appreciate that. I'm excited.
Yeah. So yes, my background is actually in school psychology. I have a master's degree in school psychology. I can work as a school counselor, a director of special education. So I come from this world of education. Happened to marry a dentist. We met when he was in dental school. So along my journey, I helped run the practice and do some of the sideline things that he was needing help with. And basically got sucked into working at the practice at one point and back in 2014. So I've lived working in the dental practice. And after that experience, I really started working on the practice because, as most of you private practice owners know, it's like two full-time jobs. Being a dentist is one job, and then owning the business is a whole other job. So he definitely needed some help there. We were plateauing production wise, weren't getting a bunch of new patients. And I was like, hey, there's a lot of psychology in dentistry. People don't like this. Let's see what we can do that's different. And so Martin Dental became my first client. I did not know that would be the career I ended up becoming coming into, but really made a lot of changes in our practice. It exploded. We had a lot of success, and with that came people telling me that they wished I could help their dental practice and their other types of doctors, for that matter. So I heard that probably 20 times before I was like, okay, universe, I hear you. This is, and actually, I do believe this is my calling. Like, I love the work I do. I love being able to know the impact that we're able to make when we do it better for patients. And what I
Yeah.
love about it too is that from the business owner perspective and the doctor perspective, it's business gold. I mean,
Yeah.
taking care of people in a better, more nurturing way helps everyone. It helps profit and it helps your patients. So it's just a win-win. And that's how it all came to be, very organically and not in a straight line.
Yeah, and one thing that I love about your experience and what you have prioritized in your business is that, well, both in the practice and your consulting business, is that, I think so many times it's the clinical work and the business, the bottom line, that are sort of top of mind for a lot of practices. But you've almost put patient experience before both of those. Not to say that the clinical work is not important and the best outcome possible is not the goal and is not, the ultimate outcome. But I love that you have really doubled down on patient experience and ultimately um, it's very it's it's especially impactful, I think, for the practices that you've worked with, and so that's so cool. But speaking of patient experience, we're here to talk today about the front desk and call handling and how you handle calls from potential patients, and of course we can talk about current patients also, but more importantly, I think for today's discussion, how do you handle those calls coming in, folks that don't have a dental home yet, folks that are looking perhaps to start a relationship with the practice? I want to just start real quick, and it seems pretty high level, but why is call handling, the phone skills, why is that so important for dental practices in your experience?
Well, this is typically the first impression the patient has and the first interaction they have with the practice. And so, if this interaction doesn't go well, the patient may never walk through the door, may never get to meet the rest of the team, may never get to get introduced to the doctor. They are not going to get treatment possibly. So this call really is the gateway to the whole rest of the patient doctor relationship. And so it's extremely important it goes well. From that patient perspective, there's a lot of options. People They typically don't just call one office, they call a few when they're looking. And so if you are a team that can make a really positive impression and help them feel taken care of, you're probably going to get them to come in. So it's very important.
Yeah. So making that first impression, so important, so critical. But let's just take a step back and assume that maybe that first impression is not so great. What is the number one biggest issue that you typically encounter with clients when you work with them on call handling?
Yeah, so one of the biggest mistakes I see made is the wrong person answering the phone. The wrong individual with they don't have the personality or the skills to handle the call well. I think that's a huge problem that I see, and it's often because that's how it's always been done, right? Like Shelly's always answered the phone first, and that's just how it is. And so, but Shelly might not be the best one to do it. And the reason she might not be is because she's probably doesn't enjoy it, to be quite honest, or she doesn't emanate the right energy through the line. I mean, so much of our communication is nonverbal, and because over the phone we can't see someone's body language, we can't read all the other little nuances of their
So true.
communication. All we have is their voice and what they say, which is a small part of it, and their tone. And so if we have the wrong person there and they don't have that right energy to handle the conversation, it really spirals pretty quickly.
Yeah. So, and I was going to get to this at the end, but I want to bring it up now simply because, it is so important. And you brought this up first. As a practice manager yourself, as an administrator, what do you look for when you hire that front desk position, when you hire the person who's going to take those calls? Are you hiring primarily for, the skill set that they already have, the experience they already have? Are you hiring for personality? What are you focused on?
Absolutely, personality. All of the dental or other type of healthcare jargon can be taught.
Yep.
How to schedule can be taught, but the personality, especially in this role, is very important. So I'm looking for someone that's bubbly. I'm looking for someone that truly likes getting to know people, that likes listening, that's patient, that's willing to, really just ease into that conversation and enjoy it. And you can see, it's funny when I observe teams and I see different people answer the phone, their body language that I can see that the person can't see is so different when they are enjoying it, having fun, they're laughing with the person, they're hearing the story, they're adding into it. It's so different when the person's actually suited for it and has
Yep.
that right energy and bubbly personality, warm and welcoming.
Yeah. So number one biggest issue sounds like having the wrong person in that seat, the wrong person answering the phone. We'll call her Shelly. Sorry, Shelly's. But we'll call her Shelly. So having the wrong person in that seat, obviously mission critical, or having the right person in the seat is mission critical. But what are some other issues that you frequently encounter when you talk with practices or you observe the front desk? What are some of the other issues that are pretty common out there that you're dealing with?
Yes. So another issue I see is sort of the idea of the phone call not being the most important thing to the person at the moment. And
Mm,
it can even be the right person in the seat, but maybe they're overwhelmed with their personal life, or maybe they have a lot of admin stuff that's piling up and they're feeling, oh my gosh, I've got to get to this. Or there's another patient standing in front of them and they're feeling the pressure to get off the phone quickly because of that. So it's that feeling of rushing through the conversation and maybe not giving that caller that time that they need to explain things, to
yeah.
ask certain questions. And it's just that with intention, if you are rushing, you're not going to ask open-ended questions. You're going to, really try to control where the conversation goes. And I do think having command of the call is important, but I think
Yeah.
often the mistake is made where it's very directed, and then the patient gets off the phone and they're like, I don't know what just happened. Like, I think I booked an
Yeah.
appointment, but I'm not really sure about it. And those are the patients that you see book the appointment, but then not actually show up. And that's really frustrating for the whole team.
Yeah, it's funny you mentioned, asking the right questions, and I forget who I was talking with. It may have been you actually, but someone was saying, when it comes to a front desk handling the phone calls in dental practices, you really shouldn't be talking. You should be asking questions. I mean, and that is really what you lead with, and you have to be engaging. You have to do that. I think, yeah, getting off the phone and saying, I don't know, did I just book an appointment? That's
Well, and
don't
it's
do
funny.
that.
It's funny because I've had employees over the years say to me, they get off and they say, "Oh my gosh, that person told me their whole life story. Are you upset that I spent so much time on the phone? And I'm like, absolutely not. Like,
Yeah.
whether the patient's face to face in front of you or they're over the phone, that is so important. That time that you're taking to listen, to make the patient feel understood, to assure them it's going to be a great experience. All of those things are priceless. And I would
Yeah.
absolutely rather have that claim submission or that call to Delta come later when that patient's
Yep.
not right there. So I welcome, like, I think the number one thing with the first impression is listening.
Yeah.
People don't really, I mean, the most interesting person isn't really mostly the most likable person. Like, the patient wants to tell you their story. So
Yeah.
listen and lean into that.
Absolutely. And spoiler alert, we're going to talk about a call handling guide that Jessica
Mhm.
has put together at the end that we partnered on. And so we'll get to that. But there is a video in there that I found particularly enlightening about handling the chatty Cathys.
Yeah.
So
There,
I'm glad. What's
yeah.
that?
I'm glad you brought that up because there is a way to, like, handle it. There's a way to allow it to happen, but not let it go on for 40 minutes. Like, there are people that will run on. So yes, we, because I've lived in a dental office and worked in it, I understand the challenges. And so yes, we did include that as one of the modules to help you navigate the chatty Cathy.
Yeah, absolutely. Any other issues related to call handling or the front desk taking inquiries that you would bring up as key problems that you see when you consult with clients initially?
Yeah, I guess I would say it comes down to preparedness, whether it's being prepared with what questions to ask, how to ask them, right? How to keep them open-ended so you're getting the information you need, but also understanding and being confident to answer certain questions the patient might have. And it's always okay to say, you know what, I'm not sure. Let me get back to you on that and take the
Mhm.
person's name down versus just trying to ramble through something that you really don't understand. Maybe it's a procedure, maybe the patient's asking about something with insurance that you don't understand. I think trying to fake it till you make it sometimes causes the patient to feel uneasy about what's going to maybe happen at your practice. So,
Yeah,
really having those responses, I don't like the word scripts because I think it's great to have a framework, but it's also nice to have each person put their own flavor on it and make sure it feels good, in their own words. I help a lot of practices work with the patient side of getting out of network with insurance, and so how to talk with patients about that, how to educate them about that,
yeah,
and that is very, it can be complex and it can be confusing, and so having a script or some kind of framework that everyone's using to be cohesive in how it's discussed is really important. And
yeah.
over the phone, I think it matters even more because, again, if you say the wrong thing or you don't elaborate enough or you seem unsure, then click and they're gone. And all the marketing that people do to bring in these calls to get the questions.
That's an expensive phone call right there.
Exactly. It's like, you can do all these amazing things to get people to be interested in the practice. And then this one call, this one moment can cause it all to go out the door.
Yeah. Yeah, absolutely. Well, one other thing that I know you've spent a lot of time on, both within your own practice and also advising other practices on, is culture and team culture. So, how important is culture when it comes to cultivating, the right kind of talent to be on the other end of the phone? What do you think about that?
Oh, I think it's huge. I mean, people, not only does culture make for a good work environment where people enjoy one another and want to be there, it helps with turnover and the cost of the practice of training new people and the coming and the going of people, but also our patients feel that. Our patients can feel when we're at odds as a team or when people aren't getting along, there's conflict between the front and the back, like little side comments and eye rolls and
Yeah,
the energy. Like, people, I don't think enough people realize how much other people can sense energy and what's happening if there's a tense situation, our patients are feeling that. And so
yeah,
I think it's hugely important. And I think when we can find when we can put people where their strengths lie, where they can be really good and feel successful at their role and what they're doing, it's not only good for the patient, but it's good for them. Like, no one wants to do things that feel hard or make them uncomfortable. And so if everyone's working in their strengths and feels really positive about what they're doing, then guess what? We can all do our thing really well and come together as a team to then give our best to patients. And
Absolutely. Absolutely. So important. Well, we actually partnered not too long ago on a call handling guide, or really a series of short video trainings that dental practices can use with their teams. Uh, and this was such a cool project. I can't thank you enough for joining with us on this and for taking the lead on it. Um, what would you tell practices about the trainings that you put together? Who is it for, and what is it really designed to do? And then we'll of course let folks know where they can grab that from. But what would you say about the trainings that you've put together?
Yes, it was very fun to put together. I would say it's really for everyone. It's for the person that you bring onto your team that's maybe new to dental or that's new to the practice. I think it's great for them to take a listen. It's also really good though for people that have done it for a long time because we get stuck in our ways. I have one of our team members, like it's a little nuance of how she says something, but like like the word matters. And so
Yeah.
I catch her doing it and it's like, it's not punitive at all. I'm just like, oh, like, can we just, and she's like, oh my gosh, that's right. Like we have habits that we've had for years and years that even if you've been really seasoned at your role, I think it's great to have a refresher. And I tried in the videos to really explain why it's important because sometimes, well, change is hard always, right?
Yeah.
Like, why would we want to change something if we don't realize it's not working? So I think I really tried to explain why it's important to do it a certain way or to consider things when you're answering the phone. I wanted to really give people that understanding of why it matters and so that they can feel more compelled to adopt those habits into what they're doing.
Yeah. Do you have a favorite video of the ones that you included in the training? Is there one particular pointer or tip or trick that you're
Mhm.
really excited about?
It's been a bit, so I'd have to look at them again. And you're
It's
like,
all good. It's all good. There's so much
but
good stuff in there.
I don't
Well,
remember if I included this. I probably did because I almost always say this to people. But there's one, this is again, it's a nuance, but I do believe the details matter and like the words we use are powerful. So when someone's describing a bad dental experience they've had before or something traumatic, in any way of life, they're telling their story over the phone, and the person is listening in, and they're kind of like trying to wrap it up because they're like, I got other people waiting, and but they're being great and they're listening. Sometimes they don't know what to say.
yeah,
They're like, gosh, how do I tell this person that I'm hearing them, but also, you know, like move it along, if you will. So with that, and sometimes I'll hear people say, it's going to be okay. It's going to be okay at our office or you're okay. And it reminds me of like the parenting tip of not telling your kid they're okay when they're having a meltdown. Like, you're okay. You just skinned your knee. You're bleeding. You're okay. They're not okay. Like, that's why they're telling you their
yeah.
story because they're telling you, I'm not okay. Like, I need
That's
you to
what that's
know.
sort of what the tears and the blood demonstrate.
Yeah, exactly.
Yeah,
So to just so it's just a little tweak to, instead of saying like you're okay, to say we're going to take great care of you. It's like you're acknowledging, thank you for sharing your story. We're going to take great care of you. Our team is
yeah,
awesome. Boom, that's it, right? And the patient's like, okay, that's what I
all right,
needed to hear, right? So
yeah.
that's, I don't know if I included that in there, but if I didn't, I should have. So that is my tip.
Yeah, well, that and so much more in this call handling guide for dental practice front desks. And I can't, well, I keep saying guide, but it's really a series of video trainings. And I think anyone listening today that owns a practice, runs a practice, is engaged in handling inquiries on the phone at a dental practice, this is definitely for you. And I'm so excited that we're able to give this training away for free. And so, anyone listening today, if you are interested in getting all of the links to the video trainings that Jessica put together, just visit dentalscapes.com/front desk. You can sign up there. And if you're at all interested in continuing the conversation with Jessica and or me, you can opt into that as well. But so many opportunities for practices within that training. And Jessica, like I said, I can't thank you enough for partnering with us on that. I think it's a phenomenal series of trainings.
You, Dan.
Awesome. Well, thank you so much for dropping by, Jessica. Like I said, Jessica knows what she's talking about. She's been on here before. If you haven't checked out those last two episodes, go and do that. Definitely good stuff within there. One of them, actually, you were talking, Jessica, about how you've sort of transformed the practice with your husband. And one of the really key important elements of the patient experience that you've implemented is what we call these amenities. So that's just a teaser. Go back and check that out. It's another great conversation. And I'm so excited to have you every time you come on, Jessica. Thank you so much. And if I have my way about it, I will gently try and drag you back next time.
I
So
welcome
thank
that. I would love that.
Awesome. Well, thank you so much for being here. Thank you all for listening. If you enjoyed what you heard today, please take a moment on Apple Podcasts or Spotify or wherever you get your podcast. Take a moment and leave us a 5-star review and a short description of what you liked, even what you didn't like. Love the feedback. And in any case, thank you so much for listening. We'll be back at it. We typically release these every week or so. So I can't thank you enough. Thanks, Jessica, and we'll talk soon.
Bye, Dan.
Bye.